Hi, my name is Jessica Ray, physical therapist for Champion Fitness Physical Therapy in Champaign. I recently became certified in a new system called Astym. Astym has been around since 1996 and stands for A stimulation. Astym stimulates the healing process through the natural process in the body to increase function and decrease pain to get people back to living. Almost anyone can benefit from the Astym system, whether you have an acute injury or a chronic illness. You do have some contraindications, like a lot of manual techniques. You're not going to want to do it open an open wound, anybody with a diabetic ulcer, over a cancer site. Careful with women who are pregnant, as well as your frail and elderly patients.
But who would you use it with?
You can use it with someone who with ankle injuries, whether it be a chronic ankle sprain or a recent ankle sprain. You can use it with shin splints, knee injuries, whether it be from arthritis or from a trauma injury. You can also use it on IT band syndrome, trochanter bursitis, low back pain, SI pain.
The list goes on and on.
Yes, from head to toe.
Okay.
There's more pressure with the tools. We go over specific areas with specific pressure. We stimulate the body's natural healing process in conjunction with stretching and exercises and other techniques. The first tool is called the Evaluator. It's used as the name itself says, it evaluates the area. You're going to go up and down the tissue with certain strokes and patterns to evaluate what's going on with that particular extremity. After that, you move on to what's called the Localizer. The Localizer can be used either on the side or also on the tip. As you'll notice with these tools, they're smooth. So at any point the therapist or the patient feels any roughness, that's where there's issues that need to be addressed. At the other end of the Localizer is also an Isolator. You can use the Isolator at the end of the Localizer, or you can use the individual Isolator. And just like the name says, you're going to isolate that area and get in deep into the tissue to stimulate that healing process. The strokes depend on the area being treated, as well as what may be going on with the patient. In general, there's certain strokes. You want to go 4 times over the tissue, depending on which tools you'll be using. About 10 to 15 minutes. This is going to be in conjunction with other therapies. It's important before doing Astym that you warm up that area involved, whether you actively do it or with moist heat. It's also important to stretch prior to doing Astym as well. Once again, we're stimulating that healing process. We want increased blood flow into that tissue. Immediately after Astym, you're going to stretch again. Then you move into exercise. The purpose of the Astym system is not only to stimulate the healing process, but to give the body a blueprint of what we need those tissues to do. So it's important for that patient to be active and to do their daily activities through their stretching and with their exercises. It's also important to wean away from bracing. We don't want to stimulate a tissue, start the healing process, then put it into a brace. I'm not sure if there's an exact number on how fast it stimulates healing. There is research to support that 88% of patients that are treated with Astym in conjunction with their physical therapy will show a decrease in pain and an increase in function, and that does not matter if it's an acute injury or a chronic injury. For more information, stop by our Champaign location or give us a call at our 800 number at 877-348-8500.